I'm Vinnie Politan. The subject of my investigation is a 19-year-old teenager named Alexee Trevizo. And Alexee Trevizo was pregnant. And the question is, did she know she was pregnant? Was she hiding her pregnancy? What exactly was going on? The bottom line, though, is that this teenager is now charged with murder. Here's her story. In Artesia, New Mexico, 19-year-old Alexee Trevizo went to the hospital complaining of back pain. She was there with her mother. The nurses and doctor took her in to try to figure out what was happening. As part of their evaluation, they did a pregnancy test. It was positive. But before any of this was discussed in the patient's room, Alexee left the room to go to the bathroom down the hallway. Alexee was in labor, alone in that bathroom. The baby was delivered, but when Alexee left the bathroom, she did not have the baby with her. A hospital employee discovered the baby later wrapped in a plastic bag in the trash. From that point forward, hospital employees went into action, but the child was dead. It was an incredible tragedy and a shock for Alexee's mother. Police were called and an investigation was started. Alexee was charged with first-degree murder, but there are still a lot of questions regarding what happened inside that hospital. We'll take a closer look as we investigate the tragic case of Alexee Trevizo and her dead baby. This story is extremely tragic, obviously, and extremely sad on many different levels, but it's also a little bit perplexing. Primarily because of the setting of where all this is taking place, which is the hospital. So the first thing that really struck me is the video. And I want to take another look at the video of her as she makes her way to the bathroom where she gives birth. She's running down the hallway in the hospital, holding her backside, opens the door, goes in there, locks herself in for 18 minutes as they try to get in, and then she walks away. And I'm wondering what's on her mind as she's making her way to the bathroom. What is she thinking about? What does she know at that moment? And why is she going there? Which brings me to my first question tonight. And I think this is a significant one, and we may think it's a simple answer, but maybe it's not so simple, and it has to do with this defendant, Alexee Trevizo. Did Alexee Trevizo know that she was pregnant? Did she know? Let me bring in some experts to try to figure this out. Joining us, dual board-certified OBGYN, Dr. Greg Marchand is with us. Dr. Marchand, what does your experience tell you?
I agree with a lot of what she said. I mean, there's really no way that a woman of normal intelligence without mental impairment is going to go 9 months without realizing they're pregnant. That's basically an impossibility. But as she just brought up, there's a very real possibility of pathologic denial here. A woman with some psychological disease who keeps pushing down the possibility that she's pregnant, even though she's feeling movement in the belly, even though her belly is growing, and she seeks out things like weight loss drugs. That is a possibility, but in a normal, healthy woman, they're not going to miss pregnancy.
Now, the two people who are closest to her at that moment, right, would be, I believe, her mother and her boyfriend, who we believe was the father of the child. I want you to take a listen to their discussion. It's caught on body cam video, and this is at the hospital. Let's watch.
So what did she come here for that she told you?
She told me she had back pain.
That's it?
That's it.
Okay. Has she been having back pain before?
Yeah, pain for her and her hips is no, I mean, she was born with like I don't know, it was like crooked.
Her spine?
Okay, because my ex-husband, he hit me. He beat me whenever I was pregnant with her. So she was early. So she had some problems with her hips. Like I always had to take her to the chiropractor to get adjusted because she couldn't use it. Like she was always getting constipated. Like she had to get lined up, whatever. So, I mean, I've been taking her to chiropractor because I always thought, well, this time, I didn't know. I honestly didn't know she was pregnant. I didn't know. I just thought, like she said, I have back pain more. My hips are hurting me. I think I need to go to the chiropractor. I said, okay, let's go tomorrow. But she was like in really a lot of pain, and you know.
When did it start?
Like the pain?
Yes.
Yesterday she said it was really bad, that her hips were hurting and her back. And then last night we're on the phone together and she said her hips were hurting bad. I asked her if anything else was hurting, and she said just everything. And she went to sleep.
But she's a cheerleader too, so she's big in cheers. They have cheer competition. She works out. I mean.
And she's been active this whole time?
Yeah, she's been active this whole time.
Doctor, how about the fact of being active the whole time? What sort of impact can that have on your knowledge or the way you feel?
Well, it's certainly an unnecessary risk to this pregnancy. I mean, we saw her doing cheerleading things on the video. She easily could have fallen on her tummy. But I do think that fits with the type of pathological denial you probably saw here, saying that it's okay to do these things, okay to not take care of your body, because you're in denial about the fact that you're pregnant.
First, Dr. Marchand, the fact that I guess it's not even obvious necessarily, like, to medical professionals that she's necessarily pregnant as soon as she walks in. So maybe you need the test to figure it out, that it's not just, oh, you look at someone and say, oh, you're pregnant.
No, that's not going to be the case. I mean, that's very unfortunate, a very poor level of medical care, probably malpractice. Now, I absolutely agree with everything my colleague has said, that this woman was in pathologic denial to convince herself. She used that denial to manipulate her family and hide her belly bump. But as soon as that physician examined that patient, should have immediately realized this is a pregnant woman, should have immediately realized this isn't a back pain issue, this is a labor issue. And then, of course, soon enough, one of the last signs of labor before you deliver is a severe pain in the buttocks that often feels like you're going to have a bowel movement. And you see her grabbing her behind there, running to the bathroom. That should have been picked up by the ER doctor, absolutely. It's very, very unfortunate it wouldn't. Now, based on what happened, I don't think it would have changed anything, but it's very unfortunate. The medical professional should have caught that quickly.
It is surprising. It is very surprising. And again, that's the one part of this story that makes it so different than any of these other cases that unfortunately happen, is that this one is happening in a hospital. So at 11:47 p.m., first, Alexee attended school and a 3-hour cheerleading practice, right? January 26th, 2023. 11:47, she goes to the emergency department complaining of back pain and ranks it 10 out of 10. It hurts. 12:05, she is seen by a physician and she says she's not pregnant and needed to have a bowel movement and informed the doctor she was on her period. Okay. 12:28, doctors begin administering morphine and lab tests are ordered. 12:51 a.m., doctors receive a notice of positive pregnancy test. Morphine treatment continues. 1:39 a.m., Alexee informs the staff she has to go to the bathroom. Nurses remove the IV, and you've seen the video. She runs down the hall. At 1:57 a.m., Alexee exits the bathroom after giving birth by herself, locked in that bathroom. 2:38 a.m., the infant is pronounced dead. Now, obviously we know what prosecutors think here. They think this is murder, she is responsible, but is there more responsibility here? And that brings me to my next question, which is about the hospital. Did the hospital do something wrong in the treatment, in the care, in the way they handled the situation? Still with us, dual board certified OBGYN, Dr. Greg Marchand. All right, where should we start? The way I want to go through this, I'm going to go through the timeline, little pieces. You tell me what you think should happen at that moment. If she complains of back pain at 11:47, 10 out of 10, then at 12:05 sees a doctor, says she isn't pregnant and needs a bowel movement and informed the doctor she was on her period. What should happen there?
At that point, the doctor, if they have any experience, should lay their hands on the patient and realize this is almost certainly a 9-month pregnancy or a very large abdominal tumor. You may not be aware of this, but occasionally teenagers can lie, and an ER doctor needs to be very careful about what they believe in the patient's story. And very quickly after that, they could have used an ultrasound probe to verify that they were pregnant or done a number of things, but they would have needed to really start moving the transport to somewhere where they had obstetrical capabilities. And my understanding is they didn't have obstetrical capabilities at this hospital. It's a little silly and disturbing that they had to wait until a pregnancy test came back and really didn't even seem to be suspicious of pregnancy on initial presentation when she showed up in back pain that eventually turned out to be labor.
How about the administering morphine at 12:28? Obviously, she's in a lot of pain.
Yeah, I don't really have a problem with administering the morphine. That's not going to cause any problems with the pregnancy. It would be better to be monitoring the pregnancy. But at this facility, they don't have pregnancy monitoring capabilities, by my understanding. I'd also heard that she was given ketorolac as well, which is something you wouldn't want to use in pregnancy because of the effect on the fetal heart. So that may have been another mistake they made, although it wouldn't cause an effect immediately on the fetal heart. Had the baby survived, it could have caused problems down the road, but not immediately.
Okay, this is a big one for me. 12:51, the test comes back positive, right? They get the results. The morphine continues, but at 1:39, they get the results 12:51. At 1:39 a.m., she tells the staff, I have to go to the bathroom. They unhook the IV, and she goes into the hallway and runs down and ends up locking herself in. Is that problematic for you?
Not as problematic as missing the pregnancy to begin with. At this point, I assume the physician knows she's pregnant, but she doesn't seem to be in the final stages of labor. So there's no monitoring at this hospital. So they're not really making things more dangerous by unhooking her from the bed. And the assumption for the physician would be if this woman was suddenly in labor, any reasonable woman would call the call light, scream for help, or there's actually in most ER bathrooms a cord that you pull to say the nurse has to come in right away. I don't think there's any way the ER doctor could predict her doing something like the events that happened. So I really wouldn't fault them for letting a pregnant woman go to the bathroom. Of course, nobody wants a pregnant woman to deliver her baby in the toilet, but as long as that woman's going to call for help when the events unfold, it shouldn't be any type of dangerous situation.
So, and that brings me to the next question, which is about the baby. And I'm not talking about murder. I'm not talking about criminal charges here. But do you feel there's any level of responsibility for the death of that child on the hospital itself?
No, I don't feel the hospital's responsible for the death in any way. I am a little outraged by the events that happened. Every good ER doctor I've ever met, I think, would have laid hands on this patient and known they were pregnant right away. But I don't think they're responsible for the death. Those actions that occurred after the baby was born were really quite unpredictable. Even if you were to believe that she didn't know she was pregnant, to take that set of actions is just so unnatural for a woman. If you look at the scenario, a situation like that, you might not be able to hold the baby. You might scream for help. You might try to warm the baby. You might do a number of things. But to go ahead and get a plastic bag and then dispose of it and then put on the face that nothing happened, that really speaks to somebody who's thought a lot about this and has a plan for what to do when the baby comes and to plan to continue living their life as if it didn't happen.
And how about dealing with someone, now she's a teenager, but she's not 13, she's not 14. She's an adult, but a teenager, 19 years old. What are your thoughts about handling someone of that age? Are they handled differently than perhaps, someone in their 20s or 30s?
Well, from a psychological perspective, I do believe that she was exhibiting signs of pathological denial and was lying to herself over and over. Generally, in most states, when someone is pregnant, they are considered an adult for purposes of pregnancy and the care of the child. But again, it was those events after she delivered that really showed us that something very evil was going on here. You would have expected a mother, even one who wasn't expecting a baby to pop out, to at least show emotion and want to care for the baby, hold the baby, or on the other hand, they could have been so concerned about their own well-being. But this woman didn't exhibit any of those behaviors and instead somehow knew what to do with the placenta and wasn't calling for help or wasn't asking for medical attention when the placenta is coming out and bleeding is going on. These would be very frightening things for somebody who hadn't looked up what was going to happen.
Absolutely. Question. We've heard the scene described, but what happened inside that bathroom? What happened? Still with us, dual board certified OBGYN, Dr. Greg Marchand, and also joining us, clinical and forensic neuropsychologist, associate professor at Pepperdine University, and author of the book, The New Rules of Attachment, Dr. Judy Ho is with us as well. Dr. Marchand, I want to start with you first. How does someone, what do you think happened? How does she deliver a child inside that room by herself? Like, what is going on?
Well, it starts out with her running down the hallway. You see holding the buttocks area, which is one of the final signs for delivering a baby. If you were to go into a OB triage emergency room, if you say out loud, I feel like I'm going to have a bowel movement, all the nurses will jump up and know that it's probably close to delivering a baby. But after she gets through the door, she most likely used some sort of squatting technique to deliver the baby. From the fact that she was walking without any kind of impairment, I don't think the morphine helped a lot. So that's one moment that really makes us think, what is going on here? How is this woman not screaming for help? As the delivery starts, if you don't have an epidural, a normal person at this point is going to scream for help, hit the call button, help me, something like that. But none of that happens. Instead, she delivers the baby, and then we've got another important moment here where the baby's out. Now, while it is true that in some cases, some babies don't start breathing right away, don't start moving right away, in no case is it going to be normal at that moment to take the actions that she took about using a plastic bag, finding a way to separate the umbilical cord from the baby, and then delivering the placenta. None of these are intuitive actions that a person would do. All of this had to be at least somewhat pre-planned of what she was going to do, including putting the baby in the bag and then arranging other things in the garbage on top of it. So that's really the scary moment, that after the baby's born, she's not screaming for help. She instead has a plan to deliver the placenta and then to try to hide what happened.
Dr. Marchand, now I know the plastic obviously would have an impact on the baby's ability to breathe if the baby survived. This will be a battle inside the courtroom to figure that out. However, if the baby was alive and was born alive and wasn't in the plastic, but is immediately after birth placed into a trash bin and left there for an hour or so, do you think the baby could have survived?
Well, I think the biggest factor there, as was later shown in the autopsy, is how tight the bag was wound. And my understanding of reading the autopsy report was that the bag was wound very tight and there just was no oxygen. It's really heartbreaking to think about, but it did seem that the baby succumbed to the fact that using all the oxygen in the bag and then passing away because there was just no air left. It's a horrible way to die. It's certainly something that boggles the mind.
Big thank you to our guest, Dr. Greg Marchand.